All right, it's still today with John and Helen, live on Plus TV Africa, your to-go family program for all of the issues that bother you. Let's welcome our first guest, Dr. Adebayo Akintayo, and he's a public health physician who has expressed himself professionally in several global and local health disciplines across different parts of the globe. Dr. Akintayo obtained an MBBS from the University of Lagos, a DTM from the Royal College of Surgeons and Physicians, Ireland. From the Institute of Public Administration of Nigeria, he got his FPA and is also certified in epidemiology for global health as well as project management for global health. Little wonder then that he is currently Director of Health Planning, Research and Statistics, Lagos State Health District 3. Dr. Adebayo Akintayo, you are welcome to our program. It's a delight to welcome you.
It's a pleasure to be here.
How are you?
I'm fine.
How is Nigeria treating you?
Well, I'm coping.
You're coping?
Yes.
And I applaud you.
Even with all of the CV?
I'm coping.
You're coping.
You're coping.
Yes.
And it's so good to hear. I was going to say, Helen, I applaud you for going through all those medical jargons flawlessly.
And I'm going to ask for him to explain some of them at the appropriate time.
Dr. Akintayo, let me welcome you to the program as well.
It's a pleasure.
We have very little time. For people like you, the time is always too short. So we'll start the questioning. Right. And should I go first, Helen?
Yes, go ahead.
Yes, I'll
go ahead.
first. Now, Dr. Akintayo, tell us, please, how has the recent economic challenges in Nigeria contributed to the reported increase in suicide cases, and what role the government's economic policies play in this trend?
And is it confirmed that there's an increase in suicide cases?
Let's go to the basics. I want to start from the definition of health. According to WHO, health is a state of complete physical, mental, and social well-being. Social well-being without absence of disease of infirmities. In other words, it doesn't exclude whether there is disease or infirmity. Now, the other dimension of it is that when we consider the economic situations, when we consider the political situations, and some other social dimensions in the society, there is no way the health situation in Nigeria or anywhere else in the on the globe will be perfect. So on that level, the economic aspects would certainly affect health. For instance, most of the time we discover that people could not afford to go to the hospital because they don't have the means or the wherewithal even to transport themselves there. Then the other fear is that when they get into the facility, the practitioners or the hospital owners or proprietors there will request for them to pay for the services even before the service is rendered. So all those things coupled together, when they could not have the financial means to do those, to maintain themselves, they fall back into a bad mental state. And that's get to the mental dimension of health.
Yeah.
Now, when we talk of mental health in medicine, it has maybe, we talk about maybe four or five areas. Where mental health specifically addresses the capacity of the well-being of an individual to recognize his or her capacities. In this society, if we take it along that line, we'll see that a lot of people are even taking up things that ordinarily, either physically or socially, or even mentally or economically, they cannot handle. Put it on another side, remind me, it's a reflection of what is happening in the society today as well. We're living in a society that is pervasive, and someone will think of having a car that is worth 140-something million. Are we thinking about the mental aspect of it?
Yeah.
Now, the other aspect is when we have talked about the capacity to recognize one's capacities, and again, the other aspect is having the ability to cope. Having the ability to cope with the normal stress of life. In life, there is going to be stress.
Yeah.
Even in free time, nothing is free. So you have the normal stress of life is to find a bearing of how to maintain the basic needs of life as enunciated by Abraham Maslow, the so-called Maslow's hierarchy of needs. And the first on that hierarchy of need is the physiological need. When we talk about the physiological need, we're talking about the housing, the food, and the housing, the food, I've forgotten the third.
Shelter, food, and health or something?
Yes, health is part of it. Now, when you look at some of those things, you discover that how many people are capable of having a decent housing in Nigeria. You see a lot of people out there, not in Nigeria alone, like I said, it's a global issue. But when you put Nigeria into perspective, we don't really have a meaningful housing program to address some of those homelessness and challenges. Then there is no regulation
that's where we're going to go.
so to even address the housing need of the common people.
Apart from the housing need.
Now let me finish on the mental so that we have broader reasons why suicide is on the increase.
Okay.
Now, I've talked about the capacity to respond to the needs in the community. I've talked about the control of stress and all that. Then the other aspect that is equally important is the fact that one must be able to live in this society or community and be able to contribute meaningfully to it. In a community will have a common interest, a common purpose, a common agenda, a shared vision, a shared mission, where they are going. Now, as an individual in that community, you must have the capacity to see what can I contribute to this community, because it's a common pool.
You have to be ready.
If you are not contributing to the common pool, what do you really expect from it?
Yeah.
But we are having a society whereby people have lost the mental balance, the ability to think through that line, that there are roles and responsibilities. When I live in the community, there are some, but unfortunately, the economic situations are really rubbish. Some of those things that mental health are supposed to address. So in essence, if anybody says he's mentally balanced in Nigeria, he's probably deceiving himself. We are all mentally challenged. The only thing is that because of the fact that internally, there is inbuilt mechanism internally that maybe we acquire during our upbringing. And that comes into the issue of first sociology. That is the parent, the home, what are the parents doing to align their children to the appropriate line of thought, to develop along the developing appropriate emotional intelligence that will enable them to know that, okay, I may not have all. Even Jesus Christ didn't have everything. When he wanted to perform his miracle, he looked for things around him. Yeah. Even his disciple didn't have it.
It's like
you it's a whole gamut of things, and if we really want to go deep, we may not really leave it.
That's right.
Okay, it's a bit reassuring to know that this is not a Nigerian,
yeah, it's global, but it's more in Nigeria because of the economic
and
situations.
you were just talking about policies and laws and all of it. So I'd like for you to shed more light in that area on the current state of public health, the policies that are available and relatable to suicide prevention in Nigeria. Are there policies? Is government interested in this area at all? Yes,
the public health is actually designed to address some of those public health issues or threats. Public health deals with the community health. The community, and when we talk of community, even where we are now is a community on its own. It's a subset of the community. Then we have the larger community, we have the society, we have the the councils, we have the states, then we have the federal, we have the nations, and we have the Committee of Nations, and so on and so forth. So and that is where the World Health Committee, the World Health Organization, is putting adequate premium on public health. Public health addresses the community health. And when we talk of community health, we're not talking about an individual health. We're talking about the health of all the individuals in the community as it affects all of us. And when we talk about that, we have to talk about the individual, the internal environment of the individual, what is going through the mind of that person. Do we care? Are we really bothered? Then we'll say, okay, be our brother's keeper. Are we truly our brother's keeper? The internal environment of that person, we don't know. The external environment, we don't know. So at every point in time, there's always a constant influx of conflicts in the internal environment of the person. Of the person.
I will hold you on.
And the external environment of all other people that surrounds, and even we have the biological environment that comprises the human beings, the animals, and so on. And you have the physical environment that comprises the environment where we live. Now, for instance, if we don't maintain a clean environment, disease entity will enter. So a mentally balanced person would not want to contaminate the environment, would not want to dump refuse indiscriminately, would not want to sneeze when he knows he's sick and spread the disease to other people. And when you say, I can't you cover your spit, why are you defecating there? Open defecation, they will be saying, is it your father's house? No, there are lots of things relatable to mental health. And the earlier we begin to handle that, the better. So the public health campaigns are ongoing on that aspect. Then to specifically address accessibility to health, the World Health Organization, of which Nigeria equally subscribes to, identified the fact that there must be universal healthcare coverage. Universal healthcare coverage means that nobody should go through any financial hardship or stress to access health when it's needed. If you need help, if you feel you are not feeling well, you have the hassle. You don't have to say, okay, I don't have money, I cannot go. No. Through universal healthcare coverage, as enunciated by the provision of the health insurance scheme that we have in Nigeria, and we have national health insurance scheme, we have Lagos State government has Lagos State health scheme, Ilera Eco and some other things that take care of the vulnerable, that take care of the health. But unfortunately, a lot of people are still not confident in align with some of those things that are actually designed to take care of their health, inclusive of the mental health.
Okay, Dr. Akintayo, let me bring you back a little bit there, because now we're beginning to look broad at public health, right? Our focus, which is suicide, I want to pick the word conflict, which you talked about earlier. Now, what, in the light of managing the cases of suicide or the incidence of suicide, what do you think our health management system should have in place, to be able to control and manage the incidence of suicide, especially in our environment?
Well, in mental health or mental disorders, if I want to put it this way, mental disorder actually is a spectrum. The suicide is the end point of the spectrum. For instance, someone that is not capable of maybe paying house rent, paying school fees, and do some other things, is anxious whenever the students are about to resume, the house rent is about to expire. The anxiety is there. And there is no social security mechanisms to take off that anxiety. There is no social support to take care of that anxiety. So the anxiety the person will feel sad. Maybe at a point the child is not sent out of school, or maybe he could not afford house rent, and there was no support anywhere. The person will feel sad. He may find maybe succor in the church or religious organization, but when he gets there and he see the display of opulence, and he say, "Okay, are you happy?" and he say he's happy, he's fine. Everybody he jumps, but internally. There are some things that are not right. So the coping mechanism and a control mechanism, when it's thrown up, the depression sets in fully. Maybe as a mild depression, then moderate depression, then severe depression, then later the social, the control mechanism is lost completely, and the person will say, "Okay, my peers are doing this, I can't do this. Language is doing that, I can't do this." And at the end of the day, what is even in this life for me? So the hope is lost. And when there is life, they say there is hope. But unfortunately, it's the reversal. When people lost hope by virtue of what they are seeing around them, by virtue of what is going internally within them, and they don't have someone that can support them within the society through the words of encouragement. Some people say, "Why are you in this? So your mates are doing this, your blah blah." The words of encouragement is not there. Through our actions, some people throw lavish parties and spray money anyhow with bangles, jewelries of thousands, and some people are still going on. They cannot afford some of those things. So the actions are not creating hope. Our words are not creating hope. Our habits are not creating hope. Our attitudes are not inspiring hope in people.
Wow.
Okay.
People are not willing to make sacrifice. I recall when I was growing, as a child, you leave your things outside, nobody will touch it. You meet it there. But now a lot of people, because of diverse distractions and contraptions that we have in the society today, a lot of people, they've lost value. Even for the human life, even the value of self-worth. That, okay, the fact that I don't have this does not mean that I cannot contribute meaningfully to my society.
Okay.
Some go into drug abuse.
Yes.
And all those things are more or less like escape routes. When they cannot find other ways, they feel that, okay, maybe if they engage in drug abuse, maybe that will maybe inspire hope in them or give them the strength of self-worth and all of that. But unfortunately, it's a dead end. And if they don't find support to bring them back in line, they will lose it, and then end up they started having suicidal ideations.
Okay. All right. We've seen a lot of, suicidal attempts, and people have actually jumped off from their houses, from the bridges, and all of that. So we've seen a lot of it, and you have painted a picture that is not very exciting. Like what's happening, and so. And when you were answering one of the questions earlier on, you talked about we should be our brother's keepers. And to be your brother's keeper, there has to be some kind of, you have to be at a particular mental state. It's like you can't take care of somebody else when you're not in a place where you're comfortable, if I can use that word in quotes. So how can the public at this point in time actively participate in reducing suicide cases, and what are the community-based initiatives that we must put in place? Because why are we here? We're here to help someone who is out there, probably is in a state, in the place where you have painted earlier on, to say, no, that's not where to be. you know, there's help somewhere. Where is help? How is help?
Well, to be fair, the government cannot do it alone. There is a strong need now for each community. When I say community, community may be people who have the same mind, they share vision, share goals, and share mission. So the community needs to start looking inwards and see how they can, first of all, map out the resources they have around them and see how they can connect all those resources together, discuss the various problems that they have within the community, share their experiences, and see how they can collectively provide solutions to it. Sometimes they may need to reach out to other communities. That is where the spirit of collaboration comes into it. There is no way an individual can solve his or her own problem. I give an example of the miracles that Jesus Christ did. There is hardly anyone that he did by himself. He used what he has around him to do it. And that's a lesson for us.
There's so much distrust.
Yes, and that's another issue. The society, the community, we have lost, there is trust deficit. We have lost trust in ourselves. Someone may not, even if he has enough, may not even want to show it in the fear that maybe in the night someone will come and kidnap or do some
or
harmful
someone who
things.
is willing to stand
That's
out
willing to do
and
it.
help people pull resources together. There's no trust.
There is no trust.
You know.
So it's a whole gamut of things. And the earlier we had to reassess ourselves individually, but I've said that there is no way society can develop without looking at the development of the individual. And development of the individual starts not when the person is grown up, has passed the age whereby you cannot bend and mold again. So most of the time, because of the economic issue and some other distractions, people have lost that opportunity at the molding phase of life. So now, if the individual is lost in the family, the attempt and the opportunity to mold the individual is lost at that value, at that area. The collection of the families will make up the community.
Yeah.
Then the community is lost. Then society, the systems, the government, and so on and so on, the institutions. So it's because the individual that will eventually come together to make the institution, work, to make the society work, to make the system work. So if everything is flawed, there is no way. And that is why we need to pay adequate attention to mental health. Right from the childhood years, at the family setting, are we addressing their emotional upbringing? At the community level, are we doing that? Someone for instance, now there is hardly any community you walk through now that will not find people abusing drugs. You see alcohol laced with so many things that we don't even know, displayed openly outside, and people have access to it to drink. You have drugs.
We'll even come back. We'll come to that if we have the time. Because I want to stay on the issue of resources that you talked about.
Okay.
The family unit is a resource.
Yes.
Of course, government too will be a resource.
Yes.
Now let's even look at what government as a resource is providing, in terms of its programs. I mean, you're a key player in the Lagos State Health Unit, put it that way. What do you think this resource, government, has been able to do to help us to tackle this issue of suicide? Because that's what we're talking about.
Specifically.
Okay, well, for instance, now the universal healthcare system that I said they put in place regarding the health insurance scheme, making sure that people are protected from financial hardship. The vulnerables are given preference.
Okay.
We have basic care provision fund that takes care of the vulnerables. And there are some set of
How do you identify?
Yes, they have
because
checklists.
that's really something. How do we identify the vulnerables?
They have checklists. There are some things they look at. Where do you live? What's your income? There are so many other things they look into.
But you have to present yourself.
Yes, but that's where I'm going. Sometimes a lot of people are ignorant about the fact that there are some schemes in place that could help them even when they require help, even within their community. So because instead of listening to some of those things that will benefit them, maybe now or even later, they will rather go on the social media and start doing all manner of things that may not really empower them either intellectually or mentally.
So that means that there is not enough awareness.
The awareness
or
is
sensitization of this.
the awareness is ongoing. I will agree it's not enough, but it can never be enough, and especially when you still have some people that have trust deficit with what the government is doing.
Yeah, that's right.
Okay. All right, I'm going to go very practical. I live in Ikeja. Almost every day, Okwebi, Oregun, Adeni Jones, that environment. There is no day you do not see a new young boy or a new young lady stark naked or in rags or just sleeping by the wayside. And I ask, there's a social welfare department, at least in Lagos State, Alausa.
Yes.
So, I'm glad that you're here. And yes, they may not be at the verge of committing suicide. We don't know what led to that. That's a mental health issue.
Certainly.
Such people, if they have family members, and I ask, isn't there someone passing from government who is aware, who has noticed, and isn't there a place, a facility, for some of these people to be helped?
Well, I think there are policies of governments, though I want to drop a hint that I'm not talking for the government, but on a personal note. There are policies that I'm aware of that addresses the social inequities in the society. But unfortunately, like I said earlier on, individually people are not aware. At the community level, they are not aware. And the point is that we're in this environment now. There is no way we can know what is happening at the next room. We need someone to connect us to it.
Okay.
So that is where the community plays a role. If you notice something unusual in your environment, don't say, no, I just want to build a shelter around myself. For as long as it does not affect me, let me just go my way. No. It doesn't portend a good sense of mental health. If you notice something unusual in your environment, you can link up to the government agencies that can assist. And there are helplines. In Lagos State, you have 112 as an helpline you can call. You have 767. There are some local governments that has helpline. All you just need is to call that line. There are dedicated line you can call and mention what you have observed. The point is that the challenge is that there is inadequate human resource to handle some of those things.
Okay,
And as a result of that, there may be a kind of delayed response. But with persistence, you might get there. And that's why I always say sometimes that there is no way you can take away the human connection from all of the. We have technologies, but the human connection is there. What do I mean by that? If you put up a call to to an organization that is not done, you have your counselors in your community.
Yeah.
You have your baales or chiefs or community or CDAs or whatever. You can route it through them and ensure that one of their representatives get it to the government's attention. By the time that is done, action will be taken. I recall some of the places where I worked, we have encountered some of those issues where we have mentally challenged people with suspicious infectious diseases, and I was called. We set up the government mechanism to ensure that those issues were taken care of. So the surveillance is not just for an individual.
Okay.
It's a community and collaborative effort.
I mean, of course, I didn't expect you to say anything else. You're a public health person. You will always look at the community. But I want to look at the complacency bit. Because more and more each day, we are beginning to isolate ourselves as units, even within streets.
Yeah.
You know, there are times when you don't even know who your neighbor is. So you're complacent about a lot of things. So what are the implications of being complacent, you know, especially, again, as it relates to helping this matter of suicide?
It's honestly, it's a dangerous trend. I still go back to my childhood year. We throw our doors open. Sometimes we just sleep over and wake up the following morning and discover that we have not closed our door. But these days, I dare not do that. Even in Ikeja. Before the day turns out, I will have been stripped naked. So now, when we go back into the Maslow's hierarchy of need as well, after the physiological need that I talk about, shelter, food, and clothing, then the next one is safety. Am I safe in this environment? If the circumstances surrounding you does not show that you are safe, then you want to recall into a safe place. It's a natural instinct. So, and that's why we have but that does not mean one should not reach out. Because whatever it is will come from the common source. We're told, even from religious trend and blah blah, that we're from the same source, Adam and Eve, or whatever other religions inclination will call it. So the point still remains that we need to go back to that root and realize the fact that I have to help people. And I don't want to start sounding examples. We have some people who have been doing that in this country. Recently, Femi Otedola walked into a school and decided to pay 1 million naira each for people there. He surveyed the environment and decided that, okay, this they don't have generator to, power. He provided it. The road is not good. They provided it. So we can have an individual, corporate organizations, a group of persons that can come together. NGOs, I know Rotary does a lot of things in that respect. Lion does a lot. So there are so many things, so many resources that we need to map and see how we can coordinate all those things together in the spirit of ensuring that we want to go back to the basis of maintaining a good mental health, because all other health revolves around mental health.
Okay, so me, myself, and I, we throw that out and look at the bigger picture. Where we are now as a people, culture plays a big role.
Yeah.
Yeah. So, is there anything in our culture? Are there any cultural factors that hinder, may hinder the effective management and prevention of suicide, for example?
Well, I would say is a misgrave. Okay, let me do a quick dive into the cultural. I'm from Yoruba descent, and I know that in Yoruba land, sometimes if the role is assigned to a king, the king is supposed to protect and ensure the security and welfare of his people. If he cannot handle it, the other people will go and say, no, you cannot handle this. Or go home, go into your inner chambers and do what you are supposed to do. So some of them will commit suicide on that basis. Even on a personal note, some may even say, okay, you've been with your wife for 10 or you cannot even bear a child and all those things. You are all manners of things. All those internal injuries that they are giving to the person may make the person to fall into the, let me just go and handle it. But the value system does not look at some of the value system is so huge that is just a part of it.
Okay.
The fact that one doesn't bear a child, a father, or a reverend sister by celibacy connotation, they still contribute meaningfully to their society. They adopt, they teach, they use their knowledge, resources, and their talent to improve their community. That's a good mental health. So those are things we need to bring up, the adoption of values that will enable us to maintain good mental health and thereby prevent suicidal tendencies.
I want to go back to Big Brother. And Big Brother in this case. Big Brother in this case will be the state government. Okay? Now you've talked about suicide being at the end of a broad spectrum of mental health disorders.
Yes, sir.
Okay. Now, do you think, in just a few words, because we're running out of time, do you think that the state government, this state government, Lagos, is doing enough to integrate policies, that will bring in public health and, to be able to touch on this issue of this huge issue on our hands, suicide? Are they doing enough? That's the question.
And let me put it this way. Yes, Lagos State, not because I'm working with the Lagos State government, but I like being fair. I think in the real sense of the word, Lagos State has taken the leadership role in charting a proper course for appropriate direction that it's supposed to go in Nigeria. And I say that without any sense of bias. I'm saying it because the primary health care, what we do in primary care is integrated primary health care. And integration means mental health is included. In fact, in primary care centers, part of what we're supposed to be doing, ideally, is to screen people for depression, which I said is the more or less like the commonest form of mental health. And everybody is going through depression. We don't have to deceive ourselves.
No, the
commonest
of mental
health is depression.
No, the commonest of mental health disorder?
Yes, is depression. The commonest of mental health disorder is depression.
And a lot of us are.
And a lot of the only thing is that we're just it's like walking, you trip, then you struggle and you get back again and you walk and you trip, and at a point you don't have the strength to get back again and you just drop it there. So the government is trying, but there are so many issues now on the issue of leadership and governance. Even at the community level, they are not looking in that direction. They see someone that is abusing drugs and every one of them just pass by without linking that person to care. That person cannot support himself again. He needs someone to lift him up.
Right.
Interesting.
I'm so glad this is coming from you.
It's deep.
I'm so glad this is coming from you, because what it means to me is like you notice the gaps.
It is everywhere.
The challenges.
The gap is
and
there.
that it means that you're also going to not sit back and say Lagos State is doing so much, but that there's still a lot more that we can do.
Certainly. We are not relating on our own.
Yes. But before you go, I had some helplines earlier on, if you would like, kindly give us those helplines again and just speak in a minute to someone who is probably at the verge of saying, I don't know what else to do. I probably need to end it.
112 is there.
112.
112 is toll free. We have 767 is there. It's toll free. Then we have Eco Telemed. Eco Telemed is there. Then at the local level, they can drop it into any of their primary care centers.
Okay.
They will assist them.
All right.
Okay, we'll have to stop it there.
We'll have to stop it there. Thank you so much.
Dr. Akintayo, certainly. I mean, you've seen a lot of situations, involving suicide attempts and the challenges generally, faced by the public health institutions, as well as, the community, the impact of the community itself. So we sincerely hope that the measures put in place and your advice to all of us collectively concerning how to control this heart-wrenching development would yield positive results for us at the end. Okay?
All right. Having said all of that, all I need to say is say thank you and well done.
It's a pleasure.
And more is expected of you and the Lagos State government so that we can give hope, especially to the younger ones. The drug addiction thing is a huge challenge. We haven't even dealt into it. Thank you for coming, sir.
It's a pleasure.
Thank you so much. All right.
So, thank you so much once again, Dr. Akintayo. Up next, we will take a look at the pros and cons of the HPV vaccine with our next guest, Dr. Ishak Lawal, an obstetrician and gynecologist. But first, let's take a quick break. We'll be right back, even before you know it.